"20 years ago, I checked myself into the hospital thinking I was having a heart attack. However, my doctor said, I'm going to prove to you it's just stress." So when this event took place, I'm thinking, it was just stress.
He said, "I don't know what's the matter with me, but I have pains in my chest again." So I said, "Are we going to the hospital?" "No, it is just stress, Pam."
I realized something was different, but I'm not going to the hospital. It's just stress.
I said, "No, it's not stress, and we need to go to the hospital." So I drove him to the doctor's office in Edison, and immediately the doctor just ushered us right in, and he put him on the EKG. He goes, "Pastor Miller, I do not like what I see." He still did not move. So he said, "Okay, Pastor Miller." And he sat back in his chair, and he goes, "I have one more question. Are you ready to make Mrs. Miller a widow today?" And with that, tears came down his face, and he said, "I will go."
That got my attention. All right, I'll go to the hospital. And then my wife asked, "Where do you suggest we go?" She said, "Hunterdon Medical Center. They have the best cardiologist. They've got a great cardiac program."
After evaluating Mr. Miller in the emergency room, we had recommended that he stay overnight for further observation and testing, including some EKGs and blood work. We had started him on some medication, anticipating that his chest pain was cardiac in nature, so we wanted to be cautious.
And he just looked at me and he said, "Bryan, you are having a heart attack."
That was potentially a warning sign of a bigger heart attack to come. Because of this abnormal blood work that he had, as well as the symptoms which brought him into the emergency room, we recommended that he undergo a heart catheterization or an angiogram.
He told me that on Thursday, the 14th, he was going to catheterize me, and he hoped he'd be able to find a blockage that he could put a stent in. If not, he said, "I'll be taking you off the table, and we'll be talking about open heart surgery." When he finished explaining everything to me, he walked through the doors, and he went outside to where my wife was in the truck, and she couldn't come in because of COVID protocol.
Dr. Schaffernak came out into the parking lot, and he explained to me, which, first of all, I will say, I could not believe that a doctor did that. He was very kind, he was very caring, very compassionate, and took probably a good 15 minutes explaining to me exactly what they were going to do.
I'm thankful he took the time to explain it to her, because it gave her a lot of peace. And then he arranged it for her to come in and for us to be able to be together just for a little bit before I got wheeled up to cardiac care.
Heart catheterization is a procedure that allows us to look at the arteries around the heart to identify if there's any blockages or abnormalities within them that would potentially explain a patient's symptoms. It's done in the cath lab under sedation. Traditionally, the procedure was always done through an artery in the groin, but over the past 10 years or so, we've transitioned and now do the procedure through an artery in the wrist, allowing for improved patient comfort after the procedure. That catheterization confirmed our suspicions that he was having a blockage. That was the cause of his chest pain. After we identified the blockages with the heart catheterization, we ended up putting in 2 stents, and subsequently he did very well after that.
I don't know if you can see it, but right there is the hole. I never knew that they could treat the heart with that small of a hole.
Bryan has been feeling so much better since the procedure. The day after the procedure, he woke up and goes, "Pam, I can't believe how good I feel."
I have been receiving the services of the Cardio Rehab Center since I had that procedure. Cardio Rehab has been a real blessing. I feel better than I have felt in years. I really value the exercise. I know that that program was totally a donation, and I'm thankful.
Bryan and I have had a very good relationship since we first met that night in the emergency room. I've enjoyed seeing him in the office several times where we've had a chance to talk about not just medicine and his healthcare, but other things like sports and family and traveling as well. And I look forward to taking care of him for many more years to come.
We've only seen Dr. Schaffernak 4 times, but I always feel like I'm going to see a friend, and I'm thankful for his friendship. We chose the Hunterdon Medical Center because our doctor recommended the hospital to us, and we're glad that he did. May I say thank you, first of all, to those that had the vision to be able to foresee this kind of program in the state of New Jersey, because I greatly benefited from the work and your sacrifice in May. So thank you to the visionaries. Thank you to those who were generous in their donations to build this wing of the hospital and care for the needs of cardiac patients. It's made a difference in our lives, made a difference in our church, made a difference in our family.